Hi, my name is Domonique Carnot and I'm a student in Nursing 673 at UHART's MSN program. I'm going to be doing a health assessment video. I'm going to be doing an advanced comprehensive mental status focused exam on my patient Della today. The first part of the assessment we'll be doing will be the orientation section. It is the most basic nursing responsibility when doing a mental status exam to assess within your patient. My first question will be, Della, can you tell me your name and your date of birth?
Name is Adela Carnot. Date of birth is November 10th, 1962.
Can you tell me what building you're in right now?
My home at 107 Royal Oak Circle in Meriden, Connecticut.
And can you tell me the date and the current year?
It is August 5th, 2022.
Patient is oriented to person, place, and time. The next section in the exam will be abstract thinking. This is the ability to find connections. So the inability to find connections may be a sign of cerebellar lesion, brain injury, developmental delay, or an intellectual disability. So my first question will be, how are apples and oranges alike?
They are both fruits.
Abstract and relevant. How are lakes and oceans alike?
They are both bodies of water.
Also abstract and relevant. How are trumpets and flutes alike?
They are both air instruments.
Also abstract and relevant. The next section of the exam will be attention. Any difficulty with attention could indicate a loss of calculating ability, which could be a sign of dementia, intellectual disability, anxiety, or depression. Della, can you count backwards by sevens starting from 100?
100, 93, 86, 79, 72. Yeah, I'm not sure.
Not accurate. The next section of the exam will be comprehension. So the patient will be given a sheet with instructions to follow those instructions and then do them. Any difficulty in understanding and executing those instructions could indicate aphasia. So Della, can you please read and follow these instructions on the sheet? What were the instructions?
Tilt my head to the left.
Okay. Able to follow instructions. And then the next set of instructions that I'd like you to read and complete on the sheet.
Close your eyes and stick your tongue out.
Able to follow instructions. The next section of the exam will be general knowledge. Information and vocabulary tests indicate intelligence, so that is what we'll be assessing for. Della, who was the first president of the United States?
George Washington.
Accurate. Who were the last 4 United States presidents?
Biden, Trump, Obama, and Bush.
Accurate. Name 5 large cities in the United States.
New York City, Chicago, Detroit, Los Angeles, and Houston.
Also accurate. The next section will be judgment. Poor judgment skills can indicate things such as delirium, dementia, disability, or psychotic states. Della, what would you do if you found a stamped and addressed envelope on the sidewalk?
I would pick it up and see who it was addressed to try to get it to that person. If not, then I would put it in the nearest mailbox.
Observations intact. The next section will be memory. Any difficulty recalling words that a patient is asked to remember could indicate things such as depression or anxiety. Della, can you remember these following 4 words and repeat them? Burger, tulip, nose, and tea.
Burger, tulip, nose, and tea.
Remote memory intact. How did you celebrate your last birthday?
My last birthday, I had dinner and cake with my family at my house.
Immediate memory intact. Can you repeat those 4 words that I just asked you to remember from before?
Burger, tulip, nose, and tea.
New learning ability also intact. The next section will be vocabulary. This ensures a patient is a non-impaired adult. Della, what would you usually like to do for fun?
I usually swim in my pool in the afternoon.
Complexity of observed vocabulary is expected for the patient's age, education level, and general ability. The next section will be articulation, in which we're looking to ensure that you can hear the patient's words clearly. We're looking not to hear any slurring or stuttering, which would be atypical traits. Della, can you tell me a little bit more about what you like to do for fun?
I swim in my pool for a few hours at the end of the day, and I also enjoy going on walks with my dog.
No observed problems with pronunciation or expression. That concludes my advanced focus mental status exam. To further go off of that exam and the assessment with my patient Della, as far as treatment protocols usually go, for mental status exams that have a lot of abnormal findings and such, the typical protocol would be maybe a referral to neurology or psychology if those services are needed per the provider. So that could be a way to kind of arc up concerns about abnormal findings to do additional workup. Other options could be sending patient for imaging, especially of the brain, cognitive evaluations to be conducted to look into any deficits found on exams a little bit more in depth, referrals to therapy for patients, and then also prescription of first-line psychiatric meds or medications for things such as dementia, Parkinson's, etc. Other important parts of the treatment protocol are going to be annual screenings, at annual physicals, such as these mental status examinations, cognitive evaluations, cognitive function tests, and depression screening forms at these annual physicals. This can help to, make sure we're frequently assessing mental status, and then also get the patient the appropriate treatment they need from here on in. Again, my name is Domonique Carnot. This was my mental status exam with my patient Della, and thank you for watching.